Let's see what the role for glucagon is. How does glucagon act? Now, glucagon, it bypasses the beta receptors. So even though beta receptors are blocked, it bypasses that. It activates through a different pathway to activate the adenylate cyclase enzyme. So ATP will be converted to cyclic-AMP and more cyclic-AMP will be there, which in turn increases the intracellular concentration of calcium and increases the myocardial contractility. So theoretically, glucagon is a very good drug. Alright. How do you give glucagon? It is given as initial IV boluses followed by IV infusion. Initial bolus can be anywhere between 3 to 10 milligram. Usually we go for a 5 milligram IV bolus in adults. This has to be followed by a continuous infusion because the effect of glucagon will last for only about 10 to 15 minutes. It has a short half-life and the effect will be evident within around 5 to 7 minutes. It's so fast acting as well. Alright. So if the initial bolus doesn't produce any response, you can give multiple boluses, but after that you need to follow it up with a continuous infusion. It can help to increase the myocardial contractility as well as the heart rate. Okay. Now the downside of glucagon is that it can cause side effects like nausea and vomiting. So if the patient is already having a depressed sensorium, not able to maintain the airway, there is always this risk of aspiration happening. Alright. Then glucagon is not very cheap. Okay. Just one vial containing 1 milligram of the drug costs more than 1,000 rupees. So when you are giving multiple boluses and continuous infusion for such a long period, usually it requires a few days of infusion till the patient recovers. It is going to be very expensive treatment. So many of the hospitals are not storing that much glucagon. Plus, there are other treatment modalities which are much more or equally effective as we can get from glucagon. Okay, one of the recommended therapies now is to go for high dose insulin therapy much earlier in the course of the disease. Alright.